What have you heard about appendicitis? Have you had appendicitis? Or do you know somebody that suffered from appendicitis? So appendicitis is a medical emergency which happens when the appendix, a tube-like structure that is attached to the end of the large intestine, becomes inflamed. So in this video, I'm going to be telling you why a ruptured appendix is a life-threatening medical emergency. Meaning I am going to be telling you the complications of appendicitis, a ruptured appendix. So first, let's start with the symptoms. The symptoms of appendicitis. The first thing you notice is severe abdominal pain. Pain in the abdominal cavity, usually starting from the belly button towards the lower right side of the abdomen. You also notice nausea and vomiting. You also notice low-grade fever. And the last symptom you notice is abdominal tenderness, especially towards the lower right side of the abdomen. I also know that you have some questions about appendix. Now, appendix is an organ that really doesn't do anything in the body. In fact, it is believed that it's leftover of evolution of humans. It's just there, it doesn't do anything in the body. Now, there are causes and risk factors of developing appendicitis or inflammation of the appendix. The first is blockage. If there's a blockage by food, tumor, stool, this can cause it to be inflamed. The second risk factor or cause of appendicitis is an infection. An infection stemming from that blockage I just talked about can cause appendicitis. The third cause or risk factor is family history. If people in your family have suffered appendicitis, you may just develop appendicitis. Another risk factor is age. This really happens to people between the ages of 10 to 30 years. If you're within this age bracket, then you should look out for these symptoms. So usually for diagnosis, when you get to the hospital, a physical exam is done. The doctor typically checks your abdomen for tenderness, especially towards the lower right region, followed by imaging tests to confirm this diagnosis. Blood tests can be done to check for signs of infection too. And for treatment, typically an appendectomy is done. I told you that this organ is believed to be remnants from evolution of man. This organ typically does nothing, so you can actually live without it. So an appendectomy is done for treatment. You'd also be placed on antibiotics to cater to any infection, and then pain management too. Now we get to the most important part of this video, that is complications of a ruptured appendix. Now, before I actually get right into it, I want to say, if you notice someone is suffering from appendicitis, it's an emergency. It's a medical emergency. You should get the person to the hospital as soon as possible, because you do not know if it has ruptured. So the first complication is the one I've been talking about from the beginning of this video, an appendix rupture. If the appendix ruptures, like I said, typically it has bacterial, stool, and some other things that are not very pleasant in there. Remember, it is located close to the large intestine. The large intestine typically carries feces. So if it ruptures, you are at risk of infection. You'll get very septic and just join people on the other side. So the second is peritonitis. If the appendix ruptures, it causes inflammation of the abdominal cavity. So even if you get that person to the hospital, doctors will have to do a lot, like bringing out your insides and, I don't know if it's washing, they call it. They'll have to do a lot to save you and put you on a lot of antibiotics, so you do not get septic and die. So please, hospital first. So the third complication is an abscess forming. An abscess can form if your appendix ruptures without you getting to the hospital in time. So there are things you can do to prevent appendicitis. The first of such things is your diet. So having a high fiber diet can significantly reduce your risk of developing appendicitis. Also, staying hydrated will help you prevent constipation. So you should do both of these things. Monitor your diet and make sure you always stay hydrated. Now, if you know somebody that is suffering from appendicitis, now it happens really quick. From severe abdominal pain, it happens very, very quickly. So make sure you get the person help. It is, like I said, a medical emergency. It is something very serious. Try to get the person help. So this is the end of this video. I hope you got value. Thank you so much for watching. Please subscribe, share, send it to people you love, and comment if you've had this experience before. I know up to like 5 people that have had an appendectomy. Have you had one? I personally haven't had it. Please share your experience in the comment section. I'll see you in my next video. Bye.